Thyroid gland is situated in front and lateral side of the trachea. It has two lobes. These two lobes are connected with a narrow part, that is isthmus. The lobes are extend from the middle of the thyroid cartilage up to the lower part of the sixth tracheal ring. Each lobe extends vertically this part, and the isthmus is located in front of the second, third, and fourth tracheal ring. Here is the cricoid cartilage. Here is the first tracheal ring. The isthmus located over the second, third, and fourth tracheal ring. Sometimes there is additional lobe found in the isthmus projecting upward up to the thyroid cartilage. This is known as the pyramidal lobe. The thyroid gland is covered with the deep cervical fascia. This pretracheal fascia encloses the gland. Here you see the upper attachment of the pretracheal fascia to the hyoid bone in the central part. In the lateral part, this goes to the thyroid cartilage, and the lower part it extends into the chest. Here is the cross section of the neck, where we see the pretracheal fascia enclosing the whole of the thyroid gland. And this fascia is important during the surgical dissection. This works as a plane of dissection. Thyroid gland is related with different structure. In the anterior lateral part, it is related with the strap muscles of the neck. In the medial side, it is lie on the trachea, and the posteriorly it is related with the esophagus, and the lateral side it is related with the carotid sheath. Here is the strap muscles of the neck. We see the sternohyoid muscle and the omohyoid muscle. After cutting these two muscles, we see here is the sternothyroid muscle, which lies in front of the lateral lobe of the thyroid, and it is attached in an oblique line in the thyroid cartilage. And the apex of the thyroid lobe is closely related with this sternothyroid muscle. Here is the posterior aspect of the neck. Here we see the pharynx and the inferior constrictor muscle that is related with the medial side of the lobe of the thyroid gland. And in the lateral side, we see that this is the carotid sheath, which is related with the thyroid gland. And here we see there are two nerves. One nerve come from the superiorly. This is the external branch of the superior laryngeal nerve, and another nerve we see it comes from the inferiorly and come to the side of the thyroid gland. This is the recurrent laryngeal nerve. In the posterior side of the thyroid gland, we see there are two glands in each lobe. There is the parathyroid glands here and here. This is the parathyroid glands that are situated over the posterior aspect of the thyroid lobe. Thyroid gland receives its blood from the superior part through the superior thyroid artery, from the inferior part through the inferior thyroid artery. Superior thyroid artery is the branch of external carotid artery, and the inferior thyroid artery is the branch of thyrocervical trunk. These two arteries supply the thyroid gland, but veins does not accompany with the arteries. There are three veins. In the upper pole, there is the superior thyroid vein, here is the middle thyroid vein, and here is the inferior thyroid vein. The superior thyroid and inferior thyroid vein drains into the internal jugular vein, and the inferior thyroid vein drains into the brachiocephalic trunk. And two important nerves are related with the thyroid gland, that is the superior laryngeal nerve and the recurrent laryngeal nerve.